All right, so hello everyone. Thank you so much for tuning in. We really appreciate you guys coming. Today is our second webinar, but this time it is with a medical student, Kelly. So Kelly, thank you so much for taking your time to be here. And first, Kelly will be talking about her journey, how she got to where she is today. And then at the end, there will be a quick Q&A session so you guys can ask her a bunch of questions and she can answer them. And yeah, that being said, the floor is all yours, Kelly.
Okay, hi everyone. I probably sound pretty weird to you, and that's because I'm from South Africa, which is a long way away from America, which I assume is where most of you guys are from. But yeah, so I'm currently a fifth year medical student in South Africa. Fifth year also probably sounds weird because I think in America it's generally a 4-year program because you have an undergrad before. But for us, the most usual way to do medicine is just straight from the beginning. We have a 6-year program. So I'm in my second last year. So I'll just speak to you a bit today about how I got here and my experiences throughout so far. Let's see if I can get this to work now. Okay, so this is basically what I'm going to go through today. And I'm just going to start with why I actually chose to do medicine, or rather kind of why I chose me, because I feel like that usually tends to happen. So what made me choose medicine was no surprise that I grew up in a family with lots of doctors. My grandfather was a pediatrician, and then my uncle currently lives in America and he's a cardiologist in Portland. And then his wife is also a doctor. She's an oncologist. And then I also have a few cousins that are also doctors. So it wasn't really a surprise to anyone when I decided that I wanted to do medicine. But that being said, it's definitely not a prerequisite to have everyone in your family being a doctor for you to do this. I think it's something that can be really accessible to anyone, and definitely not something where you need family involved to do it. But the second reason why I chose to do medicine was because of my interest in school. I knew right from early on, but I'd say mainly high school, that sciences were kind of where my interests were. I always wanted to do something in sciences, whether it was medicine or just research or something, but like maths and science and bio were always where my interests were. But then the third reason, which is probably my largest motivating factor, is I'm just so interested in the human body and how it works. And for a lot of people, I think, I don't want to generalize, but for a lot of people, a lot of their reason is they just really want to help people. And obviously doing medicine, you're helping people. And I don't want to say I don't enjoy that, because obviously, I mean, I'm not a monster. Of course, I want to help people. But I think there's quite a stigma around doing medicine because it's an interest rather than just because you want to help people and you like that's the way you want to help. And I think that if you're going to choose to do something for the rest of your life, and you're choosing at the age of 17 or 18 to do something for the rest of your life, choosing something that you're really interested in is something really important. So I think for me, that was my main driving factors. I really loved how the human body worked. Okay, so then now that I chose that this is what I wanted to do, I needed to get into medicine. And I'm sure in most places around the world, it's pretty hard and competitive to get into medicine. But in South Africa, especially, it's really competitive. And I'll explain why for a few reasons. So the first thing is that I'm not sure how much you guys know about South Africa, but we are now in this post-apartheid era. And what that means is that for a long time, there wasn't equal access to education and many other things for people of color, which for us is the majority of our country. So it was really segregated and really bad. And so now we're in a state of rectifying that problem. And so there are obviously certain quotas and things in place in order for that to be possible. And so that's an extra thing in the application process to make sure that you come, like what your background is and what your ethnicity is. That all gets taken into account quite highly in South Africa when you're applying to become a doctor. And like I said, it's really competitive. So I'm not sure of the exact numbers, but I think it's about per year over 40,000 applicants of like school leavers trying to get into medicine, and less than 2,000 spaces. So that's like less than 5% of the people that apply to become doctors aren't going to get in, which is quite it's quite sad, you know, when you work your entire high school career and this is what you want to do, and then you just can't get in because there are not enough spaces. So it's really competitive. And so it's quite weird here also that they're not very transparent about what they want from you when to get in. So you kind of just do your best and hope that it's enough. We don't have like essays that we write, like application essays, and we don't have GPAs or SAT scores. So it's a bit unsure of what you really need to get in, but these are generally the things that you need. I would say, unfortunately, that your grades are probably the most important, which sometimes it's a bit sad because the people that make the best doctors aren't always just the people that do best in high school. And in fact, probably hardly ever those people. That's generally what it takes. And then we have like a standardized test that's kind of like the SAT. Ours is called the National Benchmark Test, or NBT. And then obviously the other things you do in school, so like sports and cultural things like debating and public speaking and school plays and all those kind of things. And then community service, which, if I'm honest, is probably undervalued. I don't think it's valued as much as it should be here to get in, which is sad, but it's okay, I guess. And then, like I mentioned earlier, your ethnicity and background here is quite important, just so we can get the quality back to where it should be, and make sure that everything is proportional. So that's kind of what they look at when taking in candidates. But like I said earlier, I'm not entirely sure because they don't really make it public. Next, where I study. So I study at the University of Witwatersrand, Johannesburg, which is a very South African name and quite a mouthful. And I actually only applied to WITS, is what we call it for short, WITS, and UCT, which is the University of Cape Town. And the reason why I only applied there was because I actually forgot to apply to the other places. They usually close their application for medicine like really early on in the year. So for us, it's June because we work from January to December. So if you guys start in September, it would probably be like February or March where they would close applications. And so I kind of just forgot to apply. And so I was just lucky that I got into WITS and UCT. I actually got into both, and I chose to study at WITS. I know that their clinical medicine program is probably between the top 50 and top 100 in the world. And so for an under-resourced country like South Africa, I think that's a pretty good achievement for us. And I must say that our doctors and professors here are really like top class, and they really do know what they're doing. So definitely getting a good education here. Yeah, we also have a very interesting education here just because of our public healthcare system. So the way we have it here is we have our private healthcare system and our public healthcare system, and they're very segregated. And if you're in private, you're in private, and if you're in public, you're in public. But our teaching hospitals are all public, and they're all very understaffed, very under-resourced, and probably very different to any kind of hospital that you guys have ever seen. A lot of them are outside. And so it's a really interesting teaching environment and learning environment where you really learn to put your skills on a new level where you probably wouldn't get training like this in other parts of the world. My grandpa, who was a doctor, used to say that if you haven't seen it at Barra, which is one of our teaching hospitals, then it probably doesn't exist. And he's probably right, because actually I was in that hospital in December, and we had a patient with something called heavy chain multiple myeloma, which is a kind of cancer. And it's probably like there are less than 1,000 patients in the entire world with that condition. So really it's an amazing place to study, and doctors from all over the world come to South Africa to specialize and learn in the kind of environment that we study in. So how my degree works. So like I said earlier, it's a 6-year degree. So we start off in first and second year where we have basically, just the basics that you need. So in any kind of undergrad degree in America, this is kind of what you would do. Well, I mean, you can kind of do anything, but generally people will take the sciences, the biology, the chemistry. So that's what we do in first year. And then in second year, it's a bit more focused sciences. So we'll do anatomy, which is like all the muscles and bones in the human body, and then physiology, which is basically like the hormones and the systems that control the human body. And then molecular medicine, which is basically physiology, but on a microscopic level. So that's what our first and second year are based on. And then in third and fourth year, we call them preclinical years, where we kind of learn all the theory that you're going to ever need to become a doctor. Obviously, you don't remember it all, which is why you keep having to go back and do it all over again. But essentially, where I'm at now, where I've now finished fourth year, I should have all the knowledge I need to become a doctor. I definitely don't, but technically I should. And we do third and fourth year with body systems. So like we'll have all our subjects like pathology, which is the study of disease, and pharmacology, which is like all the medication and all these subjects, and then we apply it to a body system. So in third year, we'll do the heart, the lungs, the kidneys, and the blood, which is what all those mean. And then in fourth year, you do the brain, the muscles and bone, obs and gynae, which is like babies and pregnancy. And then GIT, which is your gastroenterology system, so like your stomach and intestines. And then we have an elective period where basically we can pick any field that we're interested in and kind of just experience what that would be like in a clinical setting, which is what I've just done now. So that's basically all the theory. And then fifth and sixth year, which is what I'm going into now, I start on Monday, is our clinical years. So that's where you take all the theory that you've learned and then you apply it in the hospitals. And what's really unique about our situation again is our hospitals are obviously very understaffed. And so you get to do things here as a medical student in fifth and sixth year that you probably wouldn't get to do anywhere else, which is, it's quite cool. For example, so I've just finished my fourth year, and the other day, like 2 weeks ago, I did something called a lumbar puncture, which is when you take a really long needle and you insert into someone's spine so you can take some fluid out. It's quite a daunting process. And usually I would say that maybe interns or registrars in America would be doing that. But because of the situation we were in, I got to learn how to do that at my level, which it doesn't sound as bad as it is for the patient. Obviously, I had doctors with me, but it's like a really unique experience. So that's something cool here. But then we have this other thing called the WITS Graduate Entry Medical Program. So this is only at my university, which is basically similar to the pre-med system, like you would have heard last week, was it? Where you do an undergrad first, and then you enter into third year, and then you basically have 4 years of medicine. I kind of wish I did this, I must say, because you get all the knowledge from a degree prior to medicine. And I really wish I did an engineering degree first, just because I find it so interesting. But I didn't, so maybe afterwards I can do something in that field. But yeah, this is also another option. If either you don't get into medicine or you're interested in something else, you just have to write a test, which is that WAPT. That's like the entry test that you have to write, and then you can enter into third year. Then after medical school, so that's 6 years of your life that you've dedicated to learning how to be a doctor, and then you still have like 6 more. So I could be wrong, but if I'm not mistaken, the way it works in America is you'll qualify as a doctor and then go straight into like an internship in a specialized field. So if you want to be a surgeon, then you'll go into like a surgical internship. Whereas here, how it works is you'll like qualify as a doctor, but then you'll do 2 years of a generalized internship. So you'll just rotate in different things. You'll do surgery, and you'll do internal medicine, you'll do pathology, and you'll just rotate through them for 2 years. So you can kind of learn how to be a doctor in every field, as opposed to just what you think you might want to do. But then after that, you're still not done. We have a year of community service, which to me, I think is really important, because obviously the country and the system has put so much into you for 6 years to teach you how to become a doctor. And so now we have a year where we get placed in a very rural area, which with not many doctors, and we give back to the community. And we are they're sometimes their only doctor that they get to see for that entire year. So it's a really rewarding year where you really get to know your patients well. And that's just what you do before you can specialize in what you want to do. So then after your community service, then you can then do your residency, fellowship, and become whatever kind of doctor you want to be, or just stay a general doctor if that's what you want to do. So it's a long process, but it's definitely worth it. And then obviously through all these years, you're still a doctor and you're getting paid and you're not studying anymore. Okay, then, so that's the whole process of what it takes to become a doctor. So it's a very long road, but what has it been like for me? Because obviously you can learn what all the steps are, but you really need to know what it's like from someone going through it. So for me, first and second year, not going to say I didn't enjoy them, but they weren't medicine. They were basically doing a general science degree. And I know a lot of people that go through first and maybe even second year, and they're like, no, medicine is not for me. I don't want to spend 6 years doing this or even longer, only to find out I don't like it. I'm just going to stop now. But that is not medicine. This is, obviously it's really important because you need this knowledge, but this is not what it's going to be like being a doctor. So even for me, I was like, I don't know if this is for me. I don't know, but let me just carry on and see what it's like. But I will say one thing that it was good for is getting used to the workload, because I'm sure it's no surprise to everyone that everyone knows that medical students have to study a lot. And it's hard just going straight from school to like suddenly being bombarded with all this clinical information that you don't understand. So first and second year for me was a really good time to get a grasp on what I'm going to have to do and how I'm going to have to study. But I didn't really take advantage of that, and I didn't develop very good study techniques, and I didn't fail anything, luckily, but yeah, I definitely didn't know my way around it well enough, but I definitely got that later, which I'll explain in a bit. But something that we did get to do in second year, which was really interesting, is dissection, which is a very unique experience, because I think it would be difficult to find someone that's not in the medical field that has opened up a dead body and looked inside of it at all of its organs. And I'd be really upset if there was someone outside the medical field that did that. But yeah, so dissection, apart from the smell, was really a unique experience that I'll never forget, and one where I learned so much, because often anatomy can be very boring because you're just learning names of muscles and bones and all these nerves and arteries that you can't ever remember. But then actually getting to see it on a real body and taking advantage of everything you can see was really an amazing experience. I'm not sure if they do it at all universities or at all medical schools, but yeah, we got to do that at least. Then third and fourth year, which is what I've just finished now. So that's all the preclinical stuff that I said. And like I said before, first and second year is not really medicine. So this was the real beginning of becoming a doctor and learning about diseases and how to treat people and all the things that make a doctor a doctor. I also started to get an understanding of what I think I might enjoy later on. I will touch on this a bit later, so I'll talk on that again. But yeah, now I finally developed a study strategy. So I'll go into how I study in the next slide, but I'm really grateful that I did understand what it takes to really sit down and study. And like I said, I was very surprised by the clinical aspects of medicine. So I've always been someone that I really like theory and I like understanding things, and I'm not very extroverted, which is why I wanted to do this, because it really pushed me out of my comfort zone. But when I finally did get to see a few patients, we didn't have much clinical exposure because of COVID. But when I did get to interact with patients, I was really surprised at how much I enjoyed it. And so, yeah, I really enjoyed that part of third and fourth year. And I'm really excited for this year to get to do that more. So that was a good experience for me. And then obviously, yeah, we had COVID this year. So for us, usually we would have gone to lectures at university, and we would have gone into the hospitals and interacted with patients, and we would have had our practicals and things like that. But we didn't really get to do any of that. All of our lectures were online. We didn't go into the hospitals, and we went in like maybe once every 2 weeks to do our practicals. So that was quite upsetting. So that definitely detracted from my experience, but hopefully this year will be a bit better. I guess we'll see. I really hope so. Yeah, okay, so then let's go into how I study. So everyone has their own method of studying. A lot of people like going to lectures. A lot of people like writing things down repeatedly, and then it like sticks in their head. For me, I realized that I like listening to things. So I take things in much better when I hear them. So I listen to like recordings of our lectures, which is quite nice. They record all of our lectures even before COVID. So this year was actually not so bad for me because all of our lectures were online, so I could listen to them all the time. So for me, that actually worked out quite well. But the other thing I like to do is I like to draw. And I have a journal and I always draw. So that's always been something nice for me. So I realized that when I draw things, like anything I can't remember, if I draw it, then I remember it. So it's probably a very unconventional way of studying, but it works for me. So I had to figure that out, and I did this year. So that's kind of how I study. I listen to things and I draw them. And then these are 3 resources that I use to help me along with like my lectures and textbooks is osmosis videos. I don't know if you've ever heard of osmosis. You can get a free trial. So if you're ever interested in anything medicine, go to osmosis.org. It is the best medical resource. They make short little videos on any topic about medicine you could ever imagine. And they're so useful. Wow. I really, if I could give any more thanks to osmosis, I would. Then there's something called Picmonic, which is basically they have little pictures of like crazy scenes. And then they use those little drawings and pictures to help you remember something that you wouldn't normally remember. I can't really explain without showing you one. I should have taken one, but I feel like that's very copyrighted. So I'm glad I didn't. But yeah, if you're interested, look up Picmonic, and it like things that you would never think you would remember, you remember because you have this crazy scene inside your head. So that works for me as well because I like drawings. And then the USMLE textbook. So the USMLE is the medical exam that you take to become a certified doctor in America. But they came out with their own textbook to help people prepare for their exams. And so I have the textbook just to help me study. And it's a really great like summarized textbook. So this is basically what I use to study. But then what I wanted to touch on a bit is, I think one of the most asked questions I get is, how do you study so much? Do you have to study? Do you have a social life? Like, do you sit for 8 hours a day and study? And you do have to study a lot. I'm not going to lie and tell you that like you don't have to study, because you do have to get the information into your head somehow. But I really value my exercise. So I always make sure that I have 2 hours a day for that. I make sure I have 8 hours of sleep every day. I am a true believer that if you don't sleep, you're not going to remember anything anyway. So what is the point? So I make sure I get 8 hours of sleep, and I've never pulled an all-nighter to study because you're not going to remember anything anyway. So sleep and exercise. I also definitely socialize with my friends pre-COVID time. I have my boyfriend that I like to see throughout the week. So you can definitely still have a life and a social life while being a medical student and a doctor. You just have to be like quite strict with your time management, but it's definitely doable. Then this year, so I'm now going into my 5th year, which like I said is like in the hospitals with the patients. And something that I said I would come back to later was that I developed an interest in what I think I might want to do later on, which is immunology and the study of the immune system and allergies and basically how your body reacts to diseases. I'm really interested in that. But a piece of advice that I once got from a 6th year was forget that. Try keep it out of your mind of what you think you might want to do. Because otherwise, for the next 2 years where you're learning about the heart and the brain and all these other systems, you're going to hate your life for the next 2 years. And so I really want to take that in and make sure that I keep an open mind, because who knows, maybe I think I want to do immunology, but then I found out actually surgery is great and I want to be a surgeon, which I would have never realized if I was so close-minded to it. So I really want to go into this year being open-minded about that. And the next thing is to speak and learn from my patients. So I think it's very easy when you get to the medical side of things and become a doctor or a medical student, it's very easy to forget what it's like to be a patient. And you remember when you're the patient that goes to the doctor again, and you're like, oh, right, it's actually really horrible being a patient. And so I actually once had an experience with one of my patients at the end of this year, or last year, 2020, where, so obviously in the like public healthcare, the clinics are really overrun and there are lots of patients to see. And sometimes the patients would come from 4 a.m, or sometimes they would even sleep outside the hospital just to be seen the next day, because otherwise they would have to go home and come again the next day or the next week. And so I think it's really easy to forget what it's like to be a patient, especially in South Africa. And so learning to speak to my patients and really hear them is something that I really want to keep in mind this year. The next thing is learning from my patients. So obviously in textbooks and in lectures, our doctors keep telling us like what are the most common signs that you should look for and what this disease looks like. But then you see a patient with that exact same disease and they have something completely different. And then you see another patient and they have the exact same thing as the last patient, but that's not what you learned about in class. And so I think it's really important that you need to keep in mind that you're actually looking at a human being and not a textbook. And if this is what you're seeing in front of you again and again, then this is clearly what is commonly presenting as in the patients. So I really want to not just think about my textbook and my lecturer, and I want to really look at the patient in front of me and make sure I'm not just ignoring their actual complaints and their signs. And the other thing that I found to be quite important is if you don't ask to see things or ask to do things, you're not going to get to do them. And I think this applies in school and in your pre-med as well, that a lot of the time, if you just ask, you're going to get to do it. And so I struggle with this a lot because I'm quite shy and introverted, but I really want to challenge myself this year to make sure that I ask to do things. And even if they say no, at least I tried, and then I'll get the chance to do it. So yeah, that's basically my experience so far as a medical student. There's probably things that I missed, but if you have any questions about anything, then yeah, feel free to ask me.
Yeah, guys, ask Kelly some questions. She's willing to answer. And again, thank you so much for your presentation, Kelly.
Sure. Oh, I see there's questions in the chat, so let me just read these. Okay, so what subject did I take in high school? So the way it works in South Africa is generally that you take 7 subjects, and those 7 are English, maths, and then 3 subjects of your choice, like you can take science or geography or whatever, like 3 of your choice. So yeah, so English, maths. Oh, then we have something called life orientation. And then we have to take an African language, so either Afrikaans or isiZulu. So you choose between those, and then those are the 7. But I actually did 10. Don't ask me why. If I had the choice to do it again, I wouldn't. But maybe that's the reason I got into medicine, who knows. But so I did science, biology, geography, and then the 3 extras that I took were Hebrew, and then AP maths, which is like advanced maths and advanced English as well. What college am I going to currently? So like I said earlier, so I go to the University of Witwatersrand in Johannesburg, or Wits for short. What education system did your school use? So I think you mean like curriculum. So it's something called the IEB. I don't know if you're from America. It's very different. But if you want to look it up, it's called IEB. I actually can't even remember what it stands for. It's been a while. I've been out of school for like 5 years now. Journeying up to middle school. So what type of doctor do I want to be? So I think I want to become an immunologist, which is like studying your immune system and how you react to diseases. But like I said, I really want to keep an open mind and see if I enjoy other things as well. And how long did it take you to get into med school? So I got into med school straight out of high school, luckily. I was actually going to take a gap year, but my parents weren't too keen on that. So I just went straight from school into medical school. Out of all the classes, what is your favorite? Do you mean out of all the classes I take, well, like I took last year in medical school? I think my favorite would probably be pathology, which is the study of diseases. So immunology is actually a branch of pathology. So it's like anything that can go wrong in the body that goes to pathology. So I find that really interesting. How did you balance pre-med, major, and social life? So like I said earlier, we don't really have a pre-med here. We kind of go straight into medicine. But I guess the first 2 years are similar to a pre-med. So yeah, so then we don't really have a major. Our subjects are kind of given to us. We don't really have a choice. And then with my social life, like I guess it's not the same for everyone. I guess some people might have more difficulty than others. I guess I was quite good at when I was studying and I got that down in a few hours, and I made sure that I retained the information that I took in, or I tried my best. And then I think it's really important that even if you maybe didn't get through as much as you wanted in the day, that you still take some time for yourself and take some time to socialize with your friends, because if your mental health isn't good, then you're not going to be able to push yourself with your studies either. And I know that burnout is so common with medical students and doctors and even high school students. So I think it's really important that you do make time for your social life. So it's just all about scheduling and making sure that you don't waste too much time on like things that aren't as important, or occasionally you might have to say no to a few things, but I think it's definitely doable as long as you just schedule. I use a notepad and schedule in everything to the hour every day. I'm like very big on taking like journaling and making sure I have a schedule. How was your medical school interview experience? So we don't have interviews. Like I said, unfortunately, it's quite different to America. Yeah, we don't really have that here, so I can't really answer that. I'm sorry. Do you recommend going to PS high school and speed through the process? I would definitely say that it's better to enjoy your like college or university experience than to speed through it and be upset about it the whole time or be stressed. Because at the end of the day, you will reach the same goal. And if it takes 1 or 2 years longer, but you have all these great memories from university and friends and real relationships, and you weren't stressed to the point where you didn't know what to do with your life the whole time, then for me, that's not even like a choice. I would definitely, I mean, it is, but I would definitely go with taking the longer route. I think that if there was a time throughout any of my studies where I was feeling like I was so overwhelmed and stressed, I would take a gap year immediately. I think it shouldn't be shameful to take time for yourself and make sure that you're taking care of yourself. So I would definitely say try and enjoy your college experience. Do you have any tips for time management as a high schooler? So like I said, for time management, I like to schedule everything. So this may make me neurotic or OCD. I don't care. If I have to say, okay, from 8 o'clock to 9 o'clock, that's my breakfast time. And then from 9 o'clock to 10 o'clock, that's when I do this class or whatever, then I'll do that for every hour of the day because that's what works for me. But if you're not someone that likes that, let me think if there's something else that maybe you could do. Maybe you could say, okay, from 8 o'clock until 12 o'clock, that's my study time. Turn your phone off, put it away, and then whatever you get done then, you get done then. And maybe schedule like chunks of the day as opposed to hours of the day. But I definitely think that scheduling is like the way to go. What coursework in medical school do you find most difficult or challenging? So sometimes I think the like biomedical molecular stuff can be quite challenging because it's working with very small molecules that you can't always comprehend. And so it's very hard to think how something works when you can't see it happening. You just have to like imagine it, which is why I like to draw things. But so sometimes that can be quite challenging. So like any hormones or molecules in your body, that can be hard. But otherwise, just managing the actual amount of work can sometimes be quite taxing and difficult. So not even the work itself, but just the volume of it can be quite challenging. Okay, next, obs and gyn perform surgery. So if you're going to want to be ob-gyn, is there something specified? So for us, and I think in America as well, surgery and obs and gynae are completely different specialties. So obviously, if you do obstetrics, which is like taking care of babies and pregnant women, you'll have to learn certain surgical procedures, like if you do a C-section on a pregnant woman, or maybe a few other certain procedures. But I think for the most part, if there was ever a complicated surgery, it would go to a surgeon, and then obs and gynae is its own like specialty. Obviously, they'll work together, but yeah, they definitely like their own things. So did you go to a BSND program? I think that would be a Bachelor of Science and ND like doctor program. I'm not 100% sure. So The way we have it here is that so the qualification is MBBCH or MBCHB, which is Bachelor of Healthcare and Bachelor of Medicine, basically, or Bachelor of Healthcare and Bachelor of Surgery. So it's a bit different here. Yeah, so MBBCH or MBCHB. What was the transition from high school to university like for you? So for me, I would say it was great. I know for a lot of other people, they struggled, but I really like doing things in my own time and scheduling my own time for things. So for me, being able to have the freedom to do that was really great, as opposed to having a school tell me when I have to do maths and when I have to do this subject and when I have to do that. So I really enjoyed it. And I have pretty good self-discipline, so that wasn't so hard for me. But I know a lot of people struggle with that self-discipline and need someone to tell them what to do. In which case I would say go to your lecturer or your professor or whoever's teaching you and tell them what they think you should be doing. I'm sure they'll tell you, I'm sure they'll give you advice. Obviously, they're not going to like mother you about it, but they'll definitely be there for guidance. And I'm sure there are other people at the college or university that can give you that kind of guidance. But the transition for me for that reason was really nice, at least. Sorry for all the questions. No, I love the questions. But do you think the IB curriculum helped you out a lot? I heard it's super difficult. My school currently does IGCSE, so I don't do. So obviously I haven't done another curriculum, so I can't say for sure, but I have taught maths and biology for the IGCSE curriculum, as well as our government curriculum in South Africa. So the IB is kind of private curriculum. And I definitely would say that it's on a pretty high level. I have looked at some other standardized tests, and I would say maybe they're a little bit easier, actually. So I definitely would say that it's quite a high level, but we get taught at that level as well. So yeah, I think it was difficult, but definitely manageable for us. And I definitely think the IGCSE is also like at that level as well. Do you recommend any study tips to retain a lot of information? Mnemonics. So that's kind of where Picmonic, like I was saying, was really good, because that gives you a picture as a mnemonic. I don't know if you guys like all know what a mnemonic is, but it's basically a study aid to help you. Like if you make a word out of the first letter of all the things you have to remember, or if you make a story out of all the things you have to remember, those are like study tips or study aids. Sorry. So mnemonics really helped me. And then, like I said earlier, drawing things. So if there's like a specific molecule or thing that I don't understand, I like to draw it, and then it kind of just sticks in my mind. Something else that a lot of people like to do is just rewriting things or saying things over and over, and then it kind of just sticks to them. But also something that also is really helpful, if you don't have a friend, use a dog. If you don't have a dog, use a teddy bear. But teaching someone is the best way to learn, because it shows you what you don't know yourself, and then you go, you look it up, and then you teach it to whatever you're teaching. So for me, teaching someone is always a really good way to learn myself. And yeah, so I'm not sure if there are any other questions, or if I didn't explain anything properly, then you can ask again. I'll try again. But I think that was all of them.
All right, cool. Thank you so much for that, Kelly. We all really appreciate your presentation, and we really enjoyed it. So thank you everyone for coming and tuning in. We will have another webinar soon, but that is all for today. Thank you so much, Kelly, once again. And yeah.
Okay, great. Thank you so much for having me, and I hope it helped at all.
All right. Bye, guys.
Bye.